It's Notes from No More Hygiene. Steve Anderson here with Dr. Tommy Nabors, and we are taking a step back in time, Dr. Nabors, I understand, to a very, very important person, Dr. Willoughby Miller. Can you see my
Absolutely.
screen,
Talk
Dr.
about before his time.
Before his time. So verbal skills today, we're going to do a little bit of contrast. This will help describe what we've known or what we've known for a long time compared to what we know today. So Dr. Nabors, tell us about Dr. Willoughby Miller.
Well, most of us in dentistry will remember from dental school, G.V. Black, as we kind of consider maybe one of the fathers of restorative dentistry or modern filling materials and things like that. We had to learn that. But I can tell you, I don't remember hearing about
No Willoughby Miller?
Not Dr. Willoughby Miller. Miller. And one of the things that it was so fascinating, of course, we're talking about the article that's in Scientific American. It's a series that we're going to be going through. This is the second issue of that, a scientific approach to cleaning your mouth. And what they're saying is Dr. Miller, back 130 years ago, was really sort of the father of oral microbiology.
130 years ago.
130 years ago. And he's referenced within a conversation about Louis Pasteur and some of the golden age of microbiology that was happening back then. And he was really tying periodontal disease to the microbes that caused it and how those microbes would affect other parts of the body in a serious way, in a pathologic way. And it's his documentation of that really, it almost took 100 years until the 1980s before what he was saying was actually ringing true, and really, to me, would be sort of the father of the oral systemic link, right out of the early areas of dentistry.
Wow. So he was way before his time.
Way.
Got it. All right. So in that context, what we've known for now 100 years is
that when we talk about what we've known, we've talked about plaque and calculus.
Mm-hmm.
Right? If we go back to using the G.V. Black reference again, I mean, we're basically, that's an amalgam reference about using amalgam and amalgam filling design. At the time, we were also learning that calculus is the cause of periodontal disease, right? And cleaning teeth is how you treat it, by cleaning and removing debris. That was then. So if we're going to contrast that to what we know now, right? What do we know now? That it's not about cleaning as it is about microbiology. And it's not so much about calculus as it is about pathogenic microorganisms and then the inflammatory reaction. And so those things are radically different. But if we kind of, to learn from history, we know that they were talking about this then. But as science and technology has begun to creep into the microbiology component, we're learning the serious effects that these microbes actually have on the body. And that's what we spend so much time talking about in terms of No More Hygiene.
He was on it. He was onto it early on. And now, it took decades after decades. It took us 100 years, or 80 to 100 years before science actually caught up and was able to prove a lot of the things that he started to uncover. So what we know now, it's all connected. There is a beautiful illustration with this that we'll include with the link that illustrates the link between periodontal disease and diabetes, which is very, very fascinating. First illustration of its kind I've ever seen, and it's beautifully done with a great explanation on how all that works.
Well, I'll say, from a historical perspective as well, Scientific American was one of the first publications that presented a series, roughly 15, 20 years ago now, one of the first publications to talk about the oral systemic link and use fascinating, really just wonderful illustrations or imaging on how that worked. And they're really following that up now with a lot more precision in terms of what we know now versus what we even knew 20 years ago. So Scientific American has been a real partner in terms of being with dentistry and applying the science and technology to disease and inflammation. And so they've really done a fabulous job with this series.
Very good. Well, you have added a new mentor to our repertoire, Dr. Nabors, Dr. Willoughby Miller from 130 years ago, a pioneer in microbiology and one of the first to put a stake in the ground that has a lot to do with where we are today.
Absolutely.
So not just a footnote in history, but a major note in history. So we'll include a link to the article and the illustration, which is, man, worth printing, I would think. It's
Absolutely
amazing. It's a great educator, and more to come. Notes every week. Thanks for joining us, and we look forward to having you join us for No More Hygiene. We have now in-person dates available, so we look forward to seeing you either online or in person. Lots to come. Thanks, Dr. Nabors, for joining us.
Appreciate it, Steve.
Talk to you all next week.